Hello, Diaz here, founder owner Greenwood Dental. Today we're discussing halitosis. Halitosis is a very fancy term for odors in the mouth. We get the most common question is, I have bad breath. So let's discuss, first of all, the causes of halitosis or bad breath. And I'm going to discuss the options, what to do about it. There are many factors contribute to bad breath or halitosis. In my opinion, number one cause is dry mouth. And dry mouth alone is caused by many different factors. One of the most common factor is medication that will affect the saliva production in the mouth. And unfortunately, some patients, they have to take these medications, obviously, for serious medical conditions. However, they are unfortunately not very well educated about the side effects, especially when the mouth comes into the picture. The effect of the medication, the many medications that a lot of us take, has a side effect of dry mouth, like blood pressure medication, like cortisol meds, cholesterol medication, heart medications, that will cause in different degrees depending on the dose, depending on the duration, and depending on also that patient physiology. So that's one cause, is basically the intake of medication. The other cause would be the lack of hydration, dehydration, whether it is physiologically or it is caused by the lack of enough water intake into the body. Remember, we need water to make saliva, just like everything else in our body, and we are made of 95% of water. So medication, habits, the food that you eat, how you're actually heal from inflammation, or how much inflammation that you have, whether it's a chronic inflammation that is causing your body to overwork in order to clear that inflammation. The other factor is B12 deficiency, which is pernicious anemia. B12 deficiency causes burning of the tongue, the lack of the vitamin, burning of the tongue, and as a result, a lot of the patient will be sucking on ice and chewing ice to cool off the burning sensation. And that could contribute, yes, to B12 deficiency, but also the burning of the tongue could be contributed to the halitosis, which is a dry mouth. So when your mouth is very dry, it hasn't been lubricated enough or moisturized enough or hydrated enough, it encourages the bacteria to create havoc in the mouth. And as a result, everything, also the lack of, everything is super dry, and the tissue is screaming at you, your tongue is not comfortable, your teeth enamel gets super dry, and the teeth start to chip. Then we have a cascade of different events that comes into play as far as the integrity of the tooth. So what should you do? Make sure that you check with your doctor as far as your medication, especially with patients that are getting chemo or also getting radiations too. But I will do another video on what we do for some of the patients that going through such aggressive treatment. So check with your doctor, make sure you understand the side effect of medication, make sure you know what medication causes dry mouth, what time of the day, could be first thing in the morning since you're taking that medication first thing, it could be the end of the day if you're taking the medication before nighttime. Make sure your mouth is clean, make sure your tongue is scraped, make sure, again, you are hydrated. Sometimes we will order artificial saliva for severe cases of halitosis because the integrity of the oral cavity depends on the lubrication, the hydration, and moisturization of the production of saliva into the mouth. So if you feel like, oh, I have bad breath, it's not necessarily systemic. We always start with eliminating the outside factors, again, habits, medication. Then if we don't find anything externally, then we can take a look at the causes possibly it is internally. So I hope that helped. That's it for today. We love you. Be safe, and DS out.